I would like to thank our sponsors, Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie, Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology, without whom this event would not be possible. So today we're going to be talking about financial resources for the caregivers, unsung heroes and advocates. In the feedback survey that I sent you a couple months ago, several of you expressed your stress at the increasing financial burden that has been placed upon you as a result of myeloma treatment and procedures. I knew that Diana, a former myeloma caregiver and professional financial advisor, would be the perfect candidate for this topic. When I reached out to her, she was more than willing to come speak to the chapter, but she didn't want to just come speak to you about financial resources. She wanted to share her perspective and her experience with you as a former myeloma caregiver. I'm really excited for you to hear from her today. She will be sharing her experience, as I mentioned, and also some key financial resources to help you feel less overwhelmed with the costs facing you. We will have a question and answer session or group discussion after her presentation. It is now my pleasure to introduce to you Diahanna Vallentine. Diahanna is a myeloma coach specializing in financial help for multiple myeloma patients and caregivers. As a professional financial consultant and a former caregiver of her husband who was diagnosed with multiple myeloma, Diahanna perfectly understands the financial issues facing myeloma patients. Diahanna, I'm so excited to hear from you today, and let's get started. Oh, you're muted, Diahanna. Diahanna, you're muted. Can you hear me? Okay. Story of our lives on these.
Hello.
Much better.
Thank you guys for inviting me. I recognize a lot of the names and I'm beginning to put names to faces, which is great. I'm going to have a huge community pretty soon. My community gets wider and wider, broader and broader, which I really appreciate. A lot of you are probably already caregivers, or you may be looking for caregivers, or you may be looking for resources to help you. I want to share, and you've all probably walked through the same fires, and we'll be walking through a lot of the same fires with caregiving. And unfortunately, some people may be taking care of more than one person at a time, maybe a spouse, a family member, or more than one family member, if you have mothers and fathers or the elderly. And a lot of financial resources out there do not just work with cancer. It may work with elderly people, people with different types of disabilities. So there's a lot of resources out there. What we're going to do at the end of this webinar is we're going to go over some of the big ones. And then there's going to be, if you get a copy of this, and I think you will get a copy of this listing, there are quite a few resources out there available to you. Whether you're going to try to find things that are state specific, federal grants or federal opportunities, there's a lot of things out there. And if I were to put all of those in the list, you'll probably get reams and reams of paper, which is really unusual because a lot of people can't find any kind of help, right? They don't know where to look, but there are things out there. And if you don't find anything on there that you think pertains to you, please, my name and number will be at the end of this, and you can contact me. I'll be glad to help you search. Okay. I think most of you guys know what a patient or caregiver is. A patient caregiver is a little bit different. You can have a caregiver of a child, you can have caregiver of a part-time caregiver, but a patient caregiver is someone who willingly chooses to spend time taking care of a family or loved one or someone they know. And it takes on a huge life of itself. It's almost like a snowball rolling down a hill. You start off with maybe taking care of one thing, helping them with food, with bathing, with transferring, or maybe just taking them back and forth for appointments. And then you find that you're giving a lot more of yourself. And it's the reason I said unsung heroes is because it's a very difficult, emotionally, physically, it's a very, very difficult job. It doesn't get any easier. It unfortunately, if you have a chronic illness like myeloma, or you have an elderly person, a lot of times it gets even more difficult because it's even more time consuming. I'll share with you, my husband was diagnosed with myeloma and he had never been sick. He worked at UPS, was a package delivery person. Then he became a manager on several different levels, and had never taken a day off ever, and worked there for 33 years. And then he started having these weird things going on with his body. And I don't know if a lot of you women may understand that a lot of men are very strong and tough, and they're not going to admit there's anything wrong. And they're going to go on, and they may not even let a spouse know what's going on, these small things, right? And that's the way my husband was. And when I noticed things that are going on, I said, honey, you need to get this taken care of. So it took me months to get him to go to the doctor. And the doctor kind of like shunned it off. Oh, this is no big deal. Like I said, no, this is not a big deal. Not a big deal, because these things it's what he's saying is fatty tissue, just doesn't happen like this. And it took me a while before we got him in, and they started running tests. But that was after I found out, I was running a life insurance policy on him, found out that the underwriter called me, there's something wrong with your husband. We need to get these results over to your doctor. And we went to the doctor the next day, and he said he has cancer, or we think it's cancer. And it ended up being MGUS, which went on for a while. And then my husband didn't want to go to the doctor when other things started coming up. And later on, he was treated for non-Hodgkin's lymphoma, which was not the cancer he had, especially when he had been diagnosed with MGUS. And it took me a long time, even after he was getting treatment for non-Hodgkin's lymphoma, to get my husband to understand. I've been researching. I had my own financial firm. I closed the door, and for months, all I did was research. I started talking to doctors and experts around, not only in our country but other countries, and realized that we're dealing with something completely different from what he's being treated for. And as a caregiver, you are essential. Because you see that person, and if you're a spouse especially, you know that person better than anyone else. And these small things you may see, maybe he's just not, he or she may not be acting the way they normally act, or they seem more tired, or the color of their skin's off, or their stomach's bothering them. These are small clues that something's going on, and you would notice them before anyone else. And if you've had the misfortune of being in the hospital with a person, and you see the doctors come in really quickly early in the morning when you're hardly awake, and they spend 5 minutes in and out, but you have these nurses who are seeing your spouse or your family member in and out different times of the day, when they're awake, and they see what's going on, and you see what's going on. So these little cues that a lot of people won't hear or see, you can appreciate, and I encourage you as a caregiver, and I'm sure a lot of you are, to bring those things up, because you are one of the main sources for that person's care. Okay, so AARP did a study in 2020 to determine how much caregivers are spending out of their own pockets to take care of their family members or loved ones, and it's roughly 20% of their income. So let's think about that: 20% of your income to take care of a loved one. So you may have had to quit your work to do that, which means your income is not coming in, or you may have reduced your hours. You may have lost your insurance. If you worked at a company, you may have lost your insurance. Now you have to scramble to get your insurance. You're also paying for the cost of your loved one's care. As we know, the prescriptions for myeloma is extremely high. It's extremely expensive. And with a lot of the new drugs coming out, which are great new treatments, but if they don't have biosimilars or they don't have generics, then you're going to pay a big portion of that cost. And so you have those things that are going out, and the cost of healthcare is going up more than inflation. Inflation is usually 3 to 4%. Healthcare generally goes up 7, 8, 9, 10% every year. So you have that additional burden. Not only do you have the emotional and the physical toll and the mental toll, but now you have a financial toll. And it's not just you that's probably feeling that. If your spouse had to leave work early, had to retire early, then you're both, he or she is dealing with that as well, because now they're no longer saving for their retirement. They're no longer saving for goals and all the things you all plan to do. And now you may have one or half of an income earner in the household. And so you're having to scramble to try to figure out how to get ends to meet. And so if you're aware of any of the articles that I've done, and they seem to all, like the circle of life sort of thing, they all seem to go around a pattern. They all touch, all these articles and topics touch, because when you are ill, or if you're not, we know that money speaks. Money speaks so you can get your care, so you can stay on care, and so that you can have a standard of living, right? And so all the articles I put together, whether it's budgeting, go and see a financial advisor, caregiving, because of the toll of caregiving, all of these things matter. I encourage you to get on HealthTree and read some of these topics, because I guarantee every single one of you out there who's in earshot of my voice can get some information off that's going to help them financially. And if you don't find something on there, or you have concern and you're afraid to ask the question, call me. I'm not going to turn you away, even if it's something that's not myeloma, even if it's like diabetes, because as you know, diabetes is another area that if you're on steroids, long-term steroids, a lot of times you become diabetic as a result of the medications. And as a loved one, and you're seeing that person who's going through these things, you're going to recognize some of those symptoms and bring it up to the doctor first. Okay, so the hardest part of caregiving is taking care of yourself. It's unfortunate that a lot of caregivers end up ill, sick. And if anybody knows anyone who's taking care of anybody with Alzheimer's, my grandmother and my mother had Alzheimer's, that a lot of the caregivers end up very, very sick as a result. So it's very important to understand when we get to the end of this, to look at some of those respite opportunities, whether it's through Medicare, through FMLA, so whatever community programs that are out there. It's very important for you all to look at respite. Don't say, well, this is my loved one. Yes, we know it's your loved one. And I had to find out the hard way. I was making myself sick. I had to step away. And unfortunately, I was doing it because I have one of those personalities who want to know everything. I think I know everything, or I want to let him know that I know everything. And he was very laid back. And so before he was even like really sick, and that was just in his 11 and a half year, I was emotionally putting out, physically putting out to the point where I needed counseling. And it wasn't helping him either. He saw what I was doing to myself. I had it get to the point where there was a lot of contention between he and I had to say, honey, I'm sorry, I have to step back. And he appreciated that, because he knew that I was going to be doing the other things, like learning about the disease, when, he was going to go to the doctor and just, yes, doctor, yes, sir, yes, sir, yes, sir. And I was not going to be that person. I told him up front, I am not your doctor's friend. I'm not here to be friends with your doctor. I'm here to save your life. I'm here to do everything I can to extend your life and have the best quality of life that you can have. And when you take that on and understand what you have limitations, every human being has limitations. And if you embrace those limitations and find ways to take care of yourself, you're going to be a better person to that person. You'll be a better caregiver to that person. And if you have young children or grandchildren you take care of, or there's things that you want to do, don't put those people aside, because they're going to feel rejected. You're going to feel the guilt for rejecting them. You're going to feel the guilt for not taking care of yourself. That person who's getting the care, they're going to appreciate you being healthier and being happier. And it's very, very important. Women have a tendency to do that. We are caregivers, we're nurturers, and we have a tendency not to take care of ourselves. And when you have children, you're on call 24 hours a day, 7 days a week. Even when you're on vacation, there's no such thing as vacation when you have children. Until they go out of the house. And hopefully when they go, you change the locks on the doors and just invite them in when they want to come in. Of course, with me, that didn't happen. As a mother, you never want to lock those doors, right? And it's the same thing when you're taking care of a person. Sometimes you need to let that person who's ill, they need their own time as well. They need time to process what's happening to their body. They need time to process that they're not the person they used to be, that all of a sudden their life is surrounded by doctor's appointments. And if you can't see that they may be going through depression, if you can't even see your own depression, or your own anxiety, then you're not going to pick up on theirs. So, caregiving is a difficult, sometimes thankless, but it's the job that I said I would not have handed over to anyone else. It was the most giving, it's hard to come up with. I would not have wanted to be anywhere else in the world there than taking care of my husband and being with him, because I learned a lot about him. I learned a lot about myself, and I learned that he was stronger than I thought he was. And I thought he was we called him a silverback, silverback apes that are very strong and very capable. We called him a silverback because he always bounced back. And I always thought that he needed to take care of me. I realized that I was capable of doing so much more. And that's so empowering. It's so empowering to have that ability to know when to push, because sometimes my husband needed to be pushed. And it was time, and know when to back off. I learned that I was a very strong person. And I'll bet every one of you, if you've been doing this, realize that you're stronger every day. And you may have to find yourself have to take it out, right? Go for a little walk, take some deep breaths. It's going to do you good. So, lost income. If you've had to reduce your hours or retire early, you maybe lose benefits like health insurance, retirement savings. You may have fewer opportunities for promotion and decreased job security, especially when we're in an environment where the jobs have been very, volatile. The job market's been very volatile. And it's never a good time to jump out of the market or out of the employment area when you really need income. But like I said, there's other ways to find income. And that's another part of the financial sphere coming together that we can talk about, or you can get onto HealthTree and start researching. Increase personal health care costs. Because if you end up sick because you're overdoing it, stress will do that, then you're going to either ignoring yourself, things get worse, you're going to end up spending more money out of your pocket for your own care. So that just hurts your entire financial picture. It hurts you being well enough to take care of your spouse and well enough to take care of yourself. It's hard to ask for help, but there are friends. I found there's some of those people I thought were friends that we hung out with for years, that we talked to on the phone every day, that we go on vacations together. When the rubber hits the road and life really hits you in the face, you start realizing who your friends are. And in some respects, it's a good thing, because you also find out those people who are just on the fringes, who you thought were just acquaintances. They come out of the woodwork, and they are there for you. The hardest thing for us is to put aside our pride and ask for help. And they are wanting to help. Don't just say, "Oh, I'll let you know." I don't care how menial you think it is. These people, these friends, these acquaintances really, really want to help. So don't hurt their feelings, because their feelings can be hurt for you not saying, "Step up. I need you to fix dinner for us. I need you to take the dog for a walk. Can you come vacuum? Can you come wipe down everything? You know how important that is right now. Can you clean my car for me? Can you make these telephone calls? Can you follow up with this? Can you follow up with that?" It's very important, because that is going to give you some of your independence back, because sometimes you feel like you no longer have that independence. And it's very important that you remember that and do that. If you're still acquainted with the church and you've been going to church, they are great resources. They have what they call these telephone tags. They have women who just can't wait to cook because their families are out of the household. Some of these women just love to cook, and they'll ask you, just like you go to a restaurant, "What can I fix for you, honey?" Tell them what they can fix for you. And here's a little tip. If anybody's taken chemotherapy and they feel like they can't eat anything, or they've had a stem cell transplant and they have no desire to eat because everything tastes like iron or tastes like metal, one of those things that really help, I found, because I've used to help people with all kinds of cancers, I used to fix food, macaroni and cheese, homemade macaroni and cheese. And you may find a person, they need calories. Macaroni and cheese is packed with calories, it's packed with taste. that may be something that you can do. You can ask somebody you know that has great recipes. If they can help, they'll be glad to help. Travel. One of the big things about when you're going from doctor's appointment to doctor's appointment is you find you're spending a lot of time in the car, or you maybe, if you're in a big city, you may have to find alternate transportation, and it can be very expensive. There are resources, financial resources out there that'll help you with transportation, lodging. If you go to another place for care out of state or out of the city for care, there's lodging and things that are available. Those things are beginning to open up. A lot of them are closed down because of COVID. They're opening up. So as a caregiver, and you find you're maybe spending a lot of your money out of pocket, there are resources out there to prevent you from having to do that. Again, give me a call, get on the HealthTree, give me a call, we can find those things. The other thing, lost savings in retirement. If you retire early or your spouse had retired early, then you may be afraid to bring these topics up with that person who's sick. Understandably so. I did the same thing. As a financial advisor, and I used to teach people about don't wait until the last minute to do things. And that's for even us who is healthy, because we don't know what's going to happen to even us tomorrow, right? We should be planning for everything. We should be planning for our own care, or for somebody to take care of us. And if we don't have anyone, then we need to find the resources that are out there, not necessarily financial resources, but manpower resources. So I encourage everybody to look at that. Don't just consider yourself as a caregiver. Consider there might be somebody who's going to be a caregiver to you. And if you're older and you have children and you think, and this is another thing that I found very difficult as a financial advisor, is a lot of people say, I don't have to worry about it because I know my daughter or my son is going to take care of me. Remember, that daughter or that son may have their own family to take care of. And that could be putting them in a uncomfortable financial position. And so when we look at caregiving, we got to understand not just for ourselves, but who down the road is going to be caregiving for us. And let's look at those resources, look at those finances. Let's look at what we have, our assets, everything that we have that's going to help us down the road. And make sure that we have all of our documents ready. Don't wait until the last minute. Don't wait for the last minute to say, who is going to do this on my behalf, or and if you feel like you're getting overwhelmed, who can step in for you to take care of that person you're taking care of? You need to do this. It may feel uncomfortable, but you need to do that. There may become time that you're too sick to, maybe you have a cold or a flu and you shouldn't be around that person. You need to have a backup plan. Okay? Please write that down. Have a backup plan for yourself if you're the caregiver. So you might also feel isolated because all of a sudden you're not doing those things or have those activities or the camaraderie with coworkers or friends or family that you used to have, because you find you get to spend so much time with that person you're taking care of. And that is not good. You need to find respite care is available for you. And you may need to contact them so you can get an hour or two, or maybe half a day out to do the shopping, to do the things you didn't get a chance to do, to go get your hair cut, to go get your nails done. It's amazing how getting your nails done can make you feel normal again, right? And we haven't been feeling normal, any of us, because we've been locked in, having to get our hair done, having to get our nails done. So these are things that you can start looking forward to, I think, with these vaccinations going on. I think there's things that we can start looking for. And there are actually people, if you contact your cancer center, a lot of times they have people who volunteer to do your hair, to do nails and things like that. And it would be free to you. So I encourage you guys to find out what your cancer resource centers or your doctor's offices have. They will hook you up with people who may be music therapists. There's a lot of things that can help not just the ill people, but the caregivers as well. Okay. Where do you get the money from? Where do you get the money from to make your ends meet when you're spending 20% or more out of your pocket for caregiving and helping that person meet their bills? It may not even be a family member. It may be a close friend that you're spending money for because you just don't want to see them without. If you're taking time off, check with the FMLA that you may have from your job to be a caregiver. There are some states that even pay for caregiving. Some Medicaid, if a person qualifies for Medicaid, or if you're a veteran, veterans have a lot of benefits available to them that a lot of people just don't know for caregiving, both the person who's not ill or the person you're taking care of. Look into those benefits. That's a first line of defense. It's what's already there that you didn't even have to pay for. And then here's another thing. If your enrollment period is coming up, think about signing up for disability that you don't have, short-term, long-term disability, or that person who's ill now, if they didn't have it through their jobs but they're still working or plan to go back to work, sign them up for short-term and long-term disability. They're not going to ask you to do a blood work or any of those screenings because you're an employee. So that gives you some additional paid time off while you're not working. And some of those things can go for short-term disability, can go for 6 months. You may have reduced income, but it's income, right? And if you have long-term disability, so a lot of the companies give you long-term disability, can go until you reach age 65, until you go on Medicare. So there's a lot of things out there, the gaps can be closed. You just need to find them. Some people feel like they need to borrow money from family and friends. And if you're caregiving, this is an astounding number. The average cost, if you were to be paid for your caregiving, for full-time caregiving, and if you're in a household with that person, that spouse, your caregiving doesn't shut down at 5 o'clock, start at 9 o'clock in the morning, shut down at 5 o'clock. It goes 24 hours a day, 7 days a week. But I'm only giving you the numbers as if you were there like a full-time job, 37 and a half to 40 hours a week. That caregiver can make $80,000 or $90,000. That would be the cost of that person. So, and if you're not working and you're spending money and you're not saving your retirement, you're not saving for the necessities, that's a lot. That's a huge hit. That's a huge hit for you, and it's a huge hit for your family. That's a huge hit for you both going forward, your standard of living. And it's sobering because some of those things are never going to go away. The cost of insurance, the cost of healthcare is never going to go down. It's just going to go up. The cost of your medications are just going to go up. The cost of having to get a car, if you need to have a car modified, and there are resources for that if you need it, it's going to be expensive. If you need handrails on your house, if you need ramps put on your house. And this was surprising to me when my husband became very ill, because he was always moving around, walking, but there were times when he became very ill that he couldn't get upstairs. I mean, unfortunately, we had a garage and there was a room inside. We had a downstairs that was finished. You can just walk right to the garage with no stairs. And he'd stay there for almost downstairs, finished basement, walkout for several months. He never saw the rest of the house. But what if you don't have that? What if you're in a big city and in order to get to the doctor's office, you have to go outside, you're around all these people, you have to worry about masks, you're worried about any and everything when you're sick, about any kind of infections, even without a pandemic being out there, right? And you have to wait for a car, you have to wait for a taxi, it may be raining. I mean, there's so many obstacles that you have to maneuver, to navigate, just to get that person to the doctor's office. And guess what? Now you got to get them back. So we seem to forget that those things are necessary. And as a caregiver, if you're the one who's struggling to get that wheelchair in and out the trunk of your car in the rain, I watched my mother do it, and I did it. It is horrible. Or if you're trying to maneuver that on ice, it's scary. In some cases, you may put in your own life in danger, taking care of that person. So these are all small things you need to look at as a caregiver. If you're in a situation now where you think you're going to be downsizing your home, or you may have to downsize your home, buy another home, think before you do it. Not just for the person who's going to need to have the extra wide hallways, or to not have carpet on the floor for safety and maneuverability, to be able to get to the toilet in a wheelchair, to be able to transfer. But think about yourself as well. If you are going to be retiring or have to retire and you're older, think about that next step. Where are you going to go? that you have those things and you've already planned ahead of time for where you're going to be so that that person can move around safely and you're going to be able to move around safely as well. And one of the things we seem to forget are doorknobs. It happened to my grandmother, and she tried to live. She's wanted. If you know my grandmother, there's a movie there about my grandmother, but she wanted everything to stay. She was going to be independent until she was 150, 160 years old. This woman was going to do everything, and she tried. I'm telling you, she tried. She didn't want the doorknobs changed out, and my mother happened to go down. Had called her on the phone. She was fine, and hours later she went to check on her. And she had been locked in a closet because she had the knobs that you turn. And she had arthritis so bad she could not turn that knob. So there's all these small things you don't think about. And with a person like myeloma has neuropathy, as caregivers, take a list, walk around your house. If you plan to stay there, walk around your house. Make sure that you have a charger, maybe a wireless charger you can have your phone sit down on versus having to maneuver getting these little things into phones. As a caregiver, you don't want to feel guilty if there was a small thing that you could have done, that you did it, that caused, undue suffering or undue time that's necessary for a person who's ill. Make sure they can open the doorknobs. You can go to Lowe's, doorknobs are not expensive. Ramps, there's things that you can do that can be taken care of. And at the end of the seminar, or webinar, you're going to see lists that will take care of some of those things. There are corporations, local companies, or nonprofits that will volunteer to come in and change out doorknobs. Surprisingly, if you're familiar with Lowe's and Home Depot, they usually have a huge, maybe a 4x4 or a trailer somewhere sitting on their lot or right off their lot. That trailer has things that people have turned in they're not going to sell again. It's not worth it to try to get packaging. You can find all sorts of things there. Okay, you can find wood, you can find doorknobs, you can find light switches, you can find all kinds of things that they sell that you may have access to. If it's a sink, you call it and see if there's sinks that wheelchairs you maneuver sinks under. There's a lot of things that you can do. As a caregiver, a lot of stuff out there. Raise your toilet. Whether you're sick or not, I'm telling you, I'm a tall person. And when my husband and I built our house, we're both tall. We had those toilets that were several inches taller, and it makes a huge difference. And then when he became ill, it was unbelievable. It helped with us helping transfer him from the toilet into a wheelchair. These are things as a caregiver and as a person who's getting older that I think you need to think about. And if you can do it and it costs to be taken care of for that person who's already ill, you'll already have things set up for yourself or have some of the things available for you in the event you needed it, right? So those are ways to cut costs. Those are ways to find things to take care of now instead of waiting until the emergency happens and you can't get him out the house. My husband became hit with sepsis 9 times. He came out of it 9 times, which is unbelievable because a lot of people don't make it through sepsis. And there are many times when he did pass and they brought him back and my husband, and they say, Mr. Valentine, are you okay? And he smiled and said, I'm okay, I'm good. And I'm thinking, honey, you were just not there. For all intents and purposes, you could have been gone. And one time it happened to him, he was at home. And to get out the front, he was on the main level. To walk out the lower level, he was on the main level, stairs to get anywhere out of the house. My son was there, fortunately, and he was in a wheelchair. And we're sitting there trying to figure out how could we get him to the car. We were my husband was a large guy, pick this wheelchair down front steps. And when he sepsis and he's already, time is of the essence. So don't wait until somebody has pneumonia or somebody is sick or they're too weak to move. Plan for these things ahead of time. You may not ever have to use them, which will be wonderful, but plan for them. And I talk a lot because I've lived through a lot of this. I've lived through the mental anguish. I've lived through guilt of no matter how much you do, you feel like you can never do enough. And that was while he was alive and after he passed. And I sometimes find myself having a pity party, and my son says, "Mom, get out of it because it's useless," right? But if I knew then what I know now, I would have saved myself a whole lot of mental anguish and stress. And that's why I'm doing what I'm doing, to save you all from mental anguish and stress, because all it takes, what on a good day is seemingly something very small, on a bad day, it's really big. And it could be the matter of life and death for a spouse or a person you love. I can't stress that enough. So, we don't like to ask for help. My husband said, "Honey, I don't need to go see a counselor because I could do it on my own." I thought I could do it on my own. But talking to someone, they're not going to tell you what to do unless there's an emergency there. But talking to someone is invaluable. They help you to clear your mind and see things that you never thought you could see. That's going to help you, and it's going to help that loved one. I encourage you to do that. Find out what your insurance pays for. Most insurance policies or programs will pay for visits like that. I encourage you to save some of that mental stress, because it's only going to make you sick, and talk to someone.
Yeah. Diahanna, I don't want to interrupt you because I love what you're saying, but I do want to give enough time for group discussion.
I'm ready for that now.
I don't know if we want to show the slides quickly that you prepared just so they can anticipate what's coming in the email. And then we can turn this over to discussion time. So Diahanna has prepared for you. And as she mentioned, there's just so many resources out there, which is encouraging. But let's just go through briefly, Diahanna, these slides so that they know what's going to be coming to them as part of these financial resources that we're going to be sharing with you today.
Okay. And I don't think this necessarily applies to cancer, because you may have other people you're taking care of or need help. Now, if a person qualified for Medicaid, there are Medicaid cash and counseling programs for a family member who's taking care of this person. So something's going to help you purchase home needs like grab bars, stairs, things that are changed at home, as well as respite care. We have somebody come in and take care of cooking, cleaning, so you have a time to get away and recollect yourself. But it also helps with transportation for a lot of these needs you're going to have going back and forth to doctors. So I would encourage you to look at that. You go to Medicaid.gov and look into those state self-directed programs, and it'll actually have a link on there, as well as senior link will give you links to state-specific and local programs, community local programs that are available to you. So don't just look at one thing. Don't just look at cancer. Look at, if a person has diabetes as well as cancer, look at the mirage, I can't say that, the group of things that can help you manage some of the costs for caregiving and for that person's care. You can also get modifications to your car if you need something to put your wheelchair on. You've seen those on the back of vans and things like that. You can also get, if you're unable to use an arm, like my husband broke his arm as a result of the myeloma, and he couldn't use an arm. He didn't want to, never did, but you can get your your steering wheel and everything can be altered. Things can be altered to help the person to stay as mobile as possible. A lot of things people don't realize that you can ask your doctor to write a prescription for, as long as it's through one of those medical supply places, because a lot of those things are there, and they have links to people who will help you put those things together. As long as something's written by your doctor, a lot of times your insurance, your Medicare and things will take care of those things for you. So think about that. Next one. Again, I'm going to mention again the veteran services, the veteran-directed home and community-based services, veterans' pensions and their aid and attendance benefits. So they all may provide some financial and other supports transportation, for home modification, for all these things, and a program of comprehensive assistance for family caregivers. It'll provide respite care, mental health services, travel expenses, and access to healthcare insurance for family caregivers. The program offers caregiver stipends. You actually give money to helping to take care of that loved one or that family member. So there's a telephone number there, the 855-260-3274, or go to caregiver.va.gov, and you can find all the resources. If you are a veteran or the person you're taking care of is a veteran, there are resources out there available to you. Don't let those things just pass you by. The next one. Structured family caregiving. A handful of states, and I do mean a handful, have been approved by the Centers for Medicare and Medicaid Services to offer structured family caregiving where the family caregiver can be paid and receive additional supports. To qualify, individual needing care must be eligible for Medicaid care, need 24-hour care and supervision, and require help from a caregiver with one or more daily personal care needs, which is bathing, dressing, walking, eating, transferring, and toileting. I'm having a hard time today with my words. So contact Caregiver Homes at www.caregiverhomes.com. They have a lot of information out there, not just for people with for Medicaid needs. The paid caregiver program locator. So you can get paid to take care of a caregiver. So there's state-specific resource tools. Contact the Family Caregiver Alliance, and you can do it online for their website. Offers a plethora of information. There's that word I was trying to get earlier. Plethora of information and tools and toolkits that you can really use for state. So you call the 1-800-445-8106, or contact your local area your agency on aging. They have a lot of information out there. So you may be 70 or 80 and have myeloma, but and you're not looking necessarily for the myeloma for this, you can look for, because you're a senior, find out what they have that you can use or benefit from as a senior. And for disease-specific resources, visit Cancer Care, like Leukemia Lymphoma Society. All these different areas for transportation, for lodging, and for help for respite care, to help give you some time off. Somebody who come and cook, clean, give medications. There's a lot of things, a lot of resources available for you. So you don't have to take that 20% won't be coming out of your pocket. The next one. And here's a Respite Resource Information Center, the ARC, and you have to put that in capitalize ARCH, National Respite Network and Resource Center. And you find that at www.archrespite.org. And then the Aging and Disability Resource Center, it's called the No Wrong Door System. See what might be available in your state on a range of long-term services and supports regardless of your age or disability. That's important. A lot of people think you have to be age 62, 65, or be on Medicare and Medicaid, but these are things for people who are disabled. You need any kind of resource, home modifications, things like that. Please contact them at 1-800-677-1116. You can also visit benefits.gov and learn about other programs and services you might qualify for. Don't forget to, like I mentioned earlier don't forget to check with your employer or your loved one's employer and to find out what kind of benefits they have, FMLA, whether it's paid or not, caregiver FMLA, or an ill family member has long-term care insurance. I was surprised at how many people don't realize that their company offers long-term care insurance. This is a big one because it's dollars on a penny if your company offers it, and if you already have it, and you may have purchased it a long time ago, and they may be taking it out of your check, and you just don't, like me, you don't look at your check stubs. That's a resource you're just giving away. I would really encourage you to look at that. A lot of people have purchased things through other employers, other jobs, and then they forget they have them. Look at your paperwork. I mean, if you've been paying and something's been automatically been coming out of an account that you rarely look at, you may have resources out there that's already paid for that you're not being aware of. State laws provide paid family leave for employees. These are the websites to look at that. It's a nationalpartnership.org. I would go to that. And then Family Voices, local affiliates will tell you about local organizations that may have funds and things available for you, including food. In the event you need food dropped off, or for people, if you don't see them every day, if you have a family member who's ill, you don't see them all the time. Even if you live in another state, you can arrange with another state to have that person taken care of. Questions? I know it's been a lot. I feel like I rambled. I hope you got some benefit out of this. I appreciate you being here and listening. I'm opening the floor up.
All right, thank you, Diana. I learned a lot, and I'm so grateful for you taking this time, sharing your experience and these resources as well. The way that we're going to do this is by using the raise hand feature. So if you're on a desktop or laptop computer, you can move your mouse to the bottom of the screen, and there should be a raise hand icon. If you click that, then we'll be able to see that you would like to speak to us. If you're on a mobile phone, or an iPad, just tap the screen, and you should that raise hand button will appear near the bottom. Or you can write in the chat. If you're not comfortable with speaking in front of the whole group, you can write your questions or even your experience in the chat as well. Yeah, I mean, we can get started. I know it's always like the little icebreaker, and we don't have a ton of time this time around, but if anybody has questions or experiences they want to share, feel free. Marsha,
one thing the area people are uncomfortable with is GoFundMe. If you find yourself short on money, it's surprising how if you get a group of friends and they do it through maybe schools or through church and your community, how if you're short on funds to take care of a treatment, to get things done around your house, you haven't been able to find the resources for that. GoFundMes are huge.
Yeah, for sure. Marsha, tell me your thoughts. I knew I could call on you.
You can. First of all, Diana, that was amazing, the information that you laid out. I'm dealing with resources all the time, but it made me think of some things that I haven't thought of. I'm a caregiver to my husband. It's been 4 years now. And I do have a specific question because he asked me about it. And maybe his myeloma, his lesions were in his spine. So there was a time, he couldn't walk. So all of that transferring and wheelchair and toilet, I did that. But thank God now he can walk. He can walk up and down the steps. But our shower in our master bath, we don't have handles. When we built our house, we did build with a little seat in it, which was good. And he asked me, wonder if there are any resources that could help us get a new shower.
It's very interesting. The first place I would start is he on Medicare by any chance?
He's actually on Medicare, and he was able to get on Medicaid because I'm in Ohio. There's a specialized recovery service, that program. Mm-hmm. Through the Council on Aging, and he got approved for that. And so he's on both.
Great. That's great. If you contact them, here's a place to go to. Go to one of those medical stores where they give you supplies. They would tell you exactly what you can get. And if they don't have it, they'll be able to tell you where to refer to. They may tell you to go ask your doctor to get a prescription to have those things done.
Okay.
They would know because they deal with that all of the time.
Nancy, do you want to say something? Oh, you're muted, Nancy. I know we always forget.
There we go. I was a home care nurse for 20 years. And so I was, trying to deal with getting people the things they needed. And one thing I found is, that a number of the larger churches have groups of men who will, do home repairs, install things for you. the civic organizations like Lions and Elks. Some of them will pay for a ramp or, something along those lines. So, think about those kind of, local resources.
Thank you, Nancy. You're absolutely right. I forgot about those, and I had them in my notes and forgot all about them. I started talking too much, but thank you. You're absolutely right.
Nancy, I'm glad you raised your hand, actually, because I think you have an interesting perspective from what I remember, and I could be remembering wrong, but it was actually on the easier end of caregiving that he didn't have as much side effects as you thought he would. Is that correct? I can't remember.
Well, he's had effects off and on, it's been an up and down kind of a thing.
Okay, maybe I'm misremembering our conversation. But sometimes I guess the reason why I introduced this is sometimes, as Diana was saying, you might be expecting the worst, and luckily it doesn't ever come to that. But it's still better to be prepared than wish you would have, I guess, is where I was going with that. Is I've talked to a couple people where it didn't get as bad as they necessarily thought it would, or and I just appreciated your comment, Diana, of you would rather be prepared.
Yeah,
right.
And don't be afraid to ask the doctor to order the home care agency. The home care agencies have social workers that will work with you at getting the resources you need as well. And,
Right.
and of course, your cancer center, most of them
Right.
have social workers.
And some of them, the home care agents will come out and look at your house, and they can actually identify things that you may not even be aware of. And one of the things, like the big one, is if a person has problems with neuropathy, getting area rugs out of the way, things that we seem to forget and we think is really nice and cozy on our feet. There are a lot of things that some of those home health agencies will come out and look at in your behalf to help you get your house ready.
Great. We still have time for a couple more comments or questions if someone wants to raise their hand or write in the chat, and we can talk. I think you really covered a lot of bases, Diana. I think you did great. Shirley, good to see you. You're muted, Shirley, if you want to unmute yourself so I can hear you. If you tap your screen, I think you're on a cell phone. So if you tap your screen, there should be buttons that show up, and then click the microphone button.
Okay. Hi, Diana. Hi, Audrey. And I'm Shirley. Hi. And the presentation was wonderful. I'm still learning. I'm a beginner, but I've had the privilege of being introduced and working with Diana, and she has helped me so much already. I mean, just at the beginning, and I know I still have so much more to go through and learn, but you're just wonderful, and HealthTree is wonderful, and I'm just so glad that I've been so privileged to get involved with you all. And as time goes on, I'm sure I'll be calling Diane on many occasions to get her expertise on everything, because she's the best.
Oh,
Thank you,
Shirley.
Diana. Thank you.
You're welcome.
She really is. She really is. All right, we do still have those a couple minutes, so I'd love to hear from you if you do have any questions, and it could be outside of this topic as well if you just have a caregiving question in general that you want to ask your peers.
I want to bring up something. It's a little off topic, but remember I said earlier, everything we do, there's a price tag attached to it.
Yeah.
As a financial advisor, I've seen everything over 20 years, and lived through a lot with my husband. And it's, I wish I could get people to understand the seriousness of when things are going good and you look at your investment accounts, everything's going good, the market's up, you listen to television, and you don't look at it, right? And or you look at it, you're really excited looking at it, right? But when the market goes down, you keep those envelopes closed, you never open them up. And you stay where you are. You may be in same positions you've been in for 10, 15 years. And I've got to tell you, that is the absolute worst thing you can do, because you could be losing money. And when you're ill and you're on a fixed income, you need to make sure that your money is working as hard for you as it possibly can. And with the bond market, a lot of people who are older or have unfixed income are looking for, CDs or aren't making any money, but they're looking for maybe bond money, or they're looking for other things. They're looking for tax-free income, which is out there. I encourage you, because there is going to be a market correction. We've done extremely well. It is coming. Do not be fooled that it's not, and don't feel like you can do it on your own. You need an expert. And there are different types of people out there that can help you. There's people who will do it for free. They'll review it, but make sure that you're getting somebody you can trust, who's qualified, and is not going to just try to take your money. And there's different ways it can be done. I am going to, not this month, but the following month, I'm going to be doing something on how to find a financial advisor. I'm going to be doing an article, actually. My next article will be how to find a financial advisor or a financial planner. And if you're on Medicare and Medicaid, you need tax-free income. You need to make sure that you're protected in the market. You need to increase your things. It's very important for you all to read this article and start looking around. I can give you some tips on how to find somebody. I don't care how little or how much money you have. I've seen people watch when the market crashed in 2008, 2009, had millions of dollars. They said, oh, the market's going to be okay. Oh, I'm just watching it go down. I'm like, yes, you're watching it go down, but maybe we need to stop it. To the point where I saw one person, and had almost $4 million in an account. They worked at Ford forever. And you know what happened to Ford in 2009? And I said, Ford doesn't just make one car, so you don't need to have one stock. You need to look at other things. And they just watched it go down to, can I say, 67,000? Now, can you afford to have your accounts do that? At the time of your life when you're not going to go back to work, may not be able to go back to work, and you're on a fixed income. I encourage you to talk to somebody. I encourage everybody to talk to somebody. Don't get caught, please.
Thank you, Diahanna. I think that's a great financial advisor perspective that perhaps we're not thinking about at this time. So thank you. We are going to end now. I'm just going to do a couple of outro announcements, including Diahanna's contact information. We will be sending the recording of this presentation and the slides. So if you didn't get to write down all of those financial resources that Diahanna wanted to share, don't worry, they are coming in an email to you, and that email will come from my email, audrey@healthtree.org. This is Diahanna's contact information. You can email her at myfinancialcoach@healthtree.org, or you can connect with her on the Myeloma Coach program website and schedule an appointment with her. Diahanna's services through the HealthTree Foundation are completely free. Our next Myeloma Caregiver chapter meeting will be on May 13th, 2021 at 7 p.m. Eastern, and we're going to be talking about eating healthy and staying healthy with registered dietitian Katie Fruit Broswell. And Katie's part of our team here at HealthTree. She's amazing, and I'm excited for you guys to hear from her about how you can stay healthy through your diet and nutrition as you're trying to take care of others as well as yourself. These are upcoming events in the Myeloma Crowd community that you might be interested in. Wednesday, April 21st at 3 p.m. Eastern is our Connect with the Myeloma Crowd chapter. Rosalind Height, who is our program director for the Myeloma Coach program, will be talking about how to find support through that Myeloma Coach program, whether you want to coach or be coached. Thursday, April 22nd at 12 p.m. Eastern is our African American Myeloma chapter. We're going to be discussing real data of African Americans with myeloma. Our research team has worked to discover some interesting information that I'm excited to share about the African American myeloma community and how it's affecting them specifically. Tuesday, April 27th at 12 p.m. Eastern is our Nutrition and Wellness for Myeloma chapter. Dr. Gulati will be discussing regulating diabetes through nutrition. And then on Wednesday, April 28th at 1 p.m. Eastern is our selinexor support group chapter. Beth Ian, who has had multiple myeloma for several years, was diagnosed as a young mother, and now her child is in high school. We'll be discussing her selinexor story. She was refractory to so many other medications, and she was told by her medical team that perhaps it was time for hospice, and then she decided to try selinexor. So it's a very inspiring, exciting story that's still developing. Those links can be found at www.myelomacrowd.org/events, and there's also many other events that I haven't discussed that are available to register for as well. Another thank you to our community sponsors, Bristol Myers Squibb, Amgen Oncology, Karyopharm Therapeutics, AbbVie Adaptive Biotechnologies, Genentech, Oncopeptides, and Takeda Oncology. And thank you to you guys for continuing to grow this Myeloma Caregivers chapter, as well as the Myeloma Crowd community by HealthTree. We really appreciate you. And Diana, thank you for sharing your time with us today. We hope that you all have a great night. Thank you so much for coming.